Chapter 8, Principles of Effective Documentation. So the documentation is a permanent record of the care we provided. It can be used as a legal document. It can be handwritten or electronic. Different names they go by are run reports, patient care reports, or PCRs, or pre-hospital care reports. EPCR is electronic patient care report. So you see that a lot these days. Reasons why we need to do accurate and complete documentation: continuity of care, education, administration, quality assurance, and legal purposes. So the elements of the PCR, you have run data and patient data. The run data is information about the call. Patient data is obviously information about the patient. Sections of the report, there's the fill-in, the stuff that you handwrite in, there's check boxes, and then your narrative. Information in the narrative, you need to be objective, but some subjective findings are okay. So your objective is your straightforward facts. Subjective is like personal opinions and viewpoints. You can include descriptions of the patient's feelings. The minimum data set that most care reports require are times, like time dispatched, time to arrive, time transported, time to arrive at the hospital, things like that. Time the patient care was transferred to more advanced providers. The chief complaint, vital signs, demographics, including age, gender, race, weight, but also patient address, maybe phone number, things like that. All right, your narrative, that tells a brief story about the patient and his or her chief complaint. You're basically painting a picture for someone that might read the report. Your objective information will be like the stuff that's fact, like the heart rate, the blood pressure, breathing rate. Subjective would be like your opinion, anything the patient might have described to you, like when they described their pain. My patient said it felt like an elephant was sitting on their chest. That would be subjective. Correcting errors. So nowadays when we're typing a report and we make an error, we can just hit backspace and erase it and just type the correct thing. But if we're doing paper reports, this is very important. We just want to do a single line through the word, initial it, and then write the correct word or number above it. Never completely cover incorrect information, whether that be by scribbling it out or using whiteout, because an attorney is going to think you're trying to hide something. Here's a picture of exactly what we're supposed to do on a paper report. You can see he drew one line through it. You can still see what the word said. He initialed it, and then he wrote the correct word next to it. So the quality of documentation is definitely a reflection of the quality of care we give. So if you do a really crappy report, people are going to assume we gave really crappy care. Collecting this data can benefit us because, it can tell us like IV success rates, things like that. So we can see where we need to improve, where we need to make changes. If someone's refusing care, obviously we need to document that they refused against our advice. Now, if you just both agree that they don't require ambulance transport, the patient's good with that, that's not necessarily refusal against medical advice. Because you can treat someone and then they can refuse transport. So maybe they're just refusing transport. Maybe they're going in their own car. Maybe they're just going to follow up with their primary care physician. But if somebody, for example, maybe they're having a heart attack, but they are adamant that they are not going to the hospital, we cannot kidnap them if they're alert and oriented. So never beat around the bush. Just flat out tell them, hey, you realize that if we don't take you, you could die. Be straightforward. And then say, if you are refusing to go, I need you to sign this saying that you are refusing care against my medical advice. Always have a witness sign it. Hopefully you've got a sheriff's deputy on scene to sign or something like that. But yeah, you make sure you document the heck out of that. There's different forms, obviously paper ones, computers, you can fill them out and then scan them in, things like that. Most places carry a laptop or a tablet, or they use their smartphone. Here's a good example of a tablet with a PCR, electronic one. Smartphones, I guess there's some applications that you can get on your smartphone, but I've never seen them used, and I don't know why you'd want to do it on such a small screen. So electronic PCRs can be useful during a mass casualty or just an incident with multiple patients, because rather than having to flip through a bunch of different pages to fill out different paper reports, you can just change tabs on your browser or whatever. It makes it super easy to do multiple patients. All sorts of legal circumstances may require a review of a report. Attorneys will request reports all the time from ambulance companies. Where we don't transport, we probably don't see that often, if at all, but it is a possibility. So just remember, if it's not documented, it didn't happen. So that's how attorneys look at it. Just make sure that you document everything you do on a call, and don't try to hide mistakes. Just be super honest in your reports. And that wraps up our documentation.